Okay, welcome back to Human Development. I decided to go ahead and record prenatal development as well as the other parts of human development across the lifespan. There's a couple things you have to do. You'll have to pause at some point and open another tab and look at two very short video clips. So the first one is prenatal development, and you won't be able to copy and paste this link obviously because it's a video, but you can just write this link down and put it into your web browser and pull it up on YouTube. It's about 8 to 9 minutes long, and then there's the labor video, which is about almost 3 minutes long. They're both animated, so it is interesting to watch. So it shouldn't gross you out entirely, again, because it's animated. So you should be able to see a dramatic and extensive transformation of human prenatal development by looking at these videos. Alright, so go ahead and pause it here and take a look at these vids and then come back. Alright, now there's some fact and fiction. Because I'm using another screensaver, I can't do my fact and fiction one by one, so we're just going to look at all of them all together. An embryo is a developing human organism between the 3rd and 8th week after conception. That is in fact true. By the end of the 3rd month, the fetus has all of its body parts. Yes, it does. At the end of the 1st trimester, a fetus has all of its body parts. Teratogens are only a concern for women who use alcohol and drugs, and we'll talk more about teratogens and what they are. And all newborn reflexes help a baby survive. We'll also talk about reflexes, and those two are false. Alright, so when we talk about from zygote to newborn, you looked at the video that showed you that pregnancy begins at conception. It showed you the process of conception, right? Where it is the egg meets, or the sperm rather, meets the egg. And this is also the starting point of the gestational age. Okay, so the organism doesn't become an embryo until about 2 weeks later, and this is usually when it is a woman is able to find out that she is in fact pregnant by that 2-week mark usually. We know that the length of pregnancy is 9 months, or 38 weeks, or 266 days, however it is you look at it. But 9 months is what we would normally call it or say. And instead of calling each period by its name, the germinal period, the embryonic period, and the fetal period, we break it down into trimesters. There's 3 different periods, but each one's a trimester. So there's the 1st, 2nd, and 3rd trimester. A due date is typically given. It's a specific date based on the last menstrual period. It says here that only 5% of babies are born on the exact date. It really is just a date for you to prepare. It's not set in stone. It's not a date that really says that you're going to have your baby on that particular day, and if not, then you are not the father. It doesn't work that way. It really just tells parents when to expect your child, so you can prepare. I'll move on. In the video, you more than likely saw implantation. And implantation is the process beginning about 10 days after conception, in which the developing organism nestles in and attaches itself to the placenta that lines the uterus. This is what it says here on my slide. The first 14 days, this is called the germinal period. And I'm really breezing through these slides, one, because I don't want you guys to have like a 30-minute video to watch, but I'm breezing through it because all of this stuff you guys more than likely already know. If you don't know about the birds and the bees and how we got here, then we're a lot behind in that case. But I'm going to breeze through these really quickly because, again, you should have seen the video. If you had not taken the opportunity to look at the video and you feel like you're a little bit confused as to what we're talking about, pause it here, go back again to the earlier part of the video, and get that link and look at those 2 short films that I said to look at in the beginning of this slideshow. Okay, now the embryonic period is the 3rd through the 8th week. So what happens during this embryonic period? Well, the brain develops. There's nerves and muscles that form links to the brain. And facial features are starting to develop. The eyes and eyelids. Now, the eyes are usually off the side of the head, but eventually the eyes do tend to migrate towards the front, where it is they don't look so alien-like, right? Then there's the external sex organs. In the beginning, you can't really tell which one's which. If you can't tell if it's a male or if it's a female. They sort of look alike in the beginning. So sometime around the 2nd trimester, you're able to tell whether or not you're having a boy or a girl. Then there's the overall appearance. The head is usually much bigger than the rest of the body. And this is mostly due to this what's called a cephalocaudal development, head first and then extremities. There's the intestines, which begin to move from the umbilical cord to the embryo's body cavity, and then there's the arms, fingers, and hands, which are really webbed in the beginning. At some point, these webbed fingers and toes, they go away, and then you start seeing normal fingers and toes. At least that's what we hope to see, is normal fingers and toes. Then we have the fetal period. The fetal period is the 9th week until birth. And from week 9 all the way up to 38 weeks, which is pretty much when it is you can give birth, there's a number of things that's happening. It's this stage of prenatal development from the 9th week after conception, and the fetus gains about 7 pounds. So that's quite a bit of weight gain. They double in their size around this time. And by the end of the 3rd month, the sex organs are visible through a sonogram, also known as an ultrasound. By 11 weeks, the rough brain structure is complete and the organ systems are present. So a lot of things are going on at this time, and at about 22 weeks after conception, it says that the fetus may survive outside the mother's uterus. Now, it says may survive. However, at 28 weeks, this is known as the age of viability, where it is a fetus can in fact survive without a doubt at 28 weeks. They may experience some developmental issues or some type of delay outside of the womb, and they may need some type of intensive care, but the age of viability is at about 28 weeks or 7 months. Alright, so how does the brain grow during the periods or stages of prenatal development? By the 100th day, the brain looks distinctly human. If you look at it, it looks pretty human. The rest of them, by 50 and by day 25, it still looks pretty alien. By week 28, brain activity begins. And various sections of the brains are actually recognizable if you were to look at it under some type of scan. Now, when the fetus is in full term, all the parts of the brain, including the cortex, the outer layers of the brain, are formed, and they fold over one another and become much more convoluted or wrinkled as the number of brain cells increases. So there's a lot of brain activity going on, not anything too complex. The part of the brain that is mostly developed is the auditory system, because in utero, the baby is able to hear mom's voice or dad's voice or a number of things that they're hearing internally. So their auditory system is in overdrive at this time, working pretty hard. What are some things a woman can do to ensure proper prenatal care? Well, there are some things that you can do. Some tests are non-invasive, such as the ultrasound. There are some other tests that detect chromosomal abnormalities or other serious problems that are invasive, but these pose a much, much greater risk. If you're over the age of 35, they have tests where it is they will check to see if your child would be at risk for Down syndrome. And so there are things that you can do to ensure proper prenatal care. The main thing is a proper diet, as well as making sure you're taking your vitamins, and then of course there's ensuring that you're going to the doctor regularly. Now once your baby's here, they're going to give your baby a test. This is called the APGAR scale, or rather they'll give your baby an APGAR score. So as soon as they're into the womb, we're already testing them. The APGAR scale assessment, it tests the baby's color. So are they blue and not breathing? They'll test for the heart rate. They'll look at reflexes, muscle tone, the respiratory effort that's given. And each time, the total of all 5 scores is compared with the maximum score of 10, which is rarely ever attained. Usually you don't come out and hear, oh, your baby has an APGAR score of 10. Normally something is lacking somewhere that they look to give you something maybe close to like an 8 or a 9, which is good. So they give them this test to see how well it is they're doing. Now, if your child is blue, chances are your child is experiencing something called anoxia. This is a complication at birth due to lack of oxygen, and 3 of the 5 criteria on the APGAR scale monitors for this potential condition. Now, if your child has cerebral palsy, this is a condition based on brain damage related to movement control. It used to be considered a result of problem birth procedures, but it's much more often related to genetic vulnerability worsened by teratogens or maternal illness. This brings us to teratogens. Teratogens are things that can affect the baby from even in utero, from within the womb. If a mother is smoking or taking drugs, that's cigarette smoke, that nicotine or whatever drug use or even alcohol can affect that baby, and as a result can cause some complications for that child once they're born. So teratogens are just that. They're things that are introduced to the newborn child in utero that can pass from mother to the unborn or newborn child. Some of these teratogens also come in the form of STDs, by the way. For example, gonorrhea. If a woman has gonorrhea and they have a child, their child can experience blindness as a result of coming through the birth canal that has been exposed to gonorrhea. So these things are very important to note. What are some newborn reflex experiences? Back on what it is they check for when they look at the APGAR scale, they look for the breathing reflex. A reflex occurs without conscious thought. There's also the sucking reflex. How well is this baby sucking? If you were to brush your finger against the cheek of a newborn baby, they're going to start moving their mouth in this sucking motion. So they look for that. Then there's something called the Mora reflex. The Mora reflex is also known as the startle reflex. So they'll hold on to their little hands and kind of like let their hands go, and then the baby normally spans their hands and legs out and then brings it back in, kind of like they got scared. So they look for that Mora reflex as well, which are things that the babies do completely automatically. Okay, so the breathing and sucking reflexes are necessary for a child's survival. However, there are some reflexes that aren't necessary for survival. They do indicate that the state of brain and body functions is important. So these reflexes tell us a lot about what the brain's doing and how the body is functioning is what that means. There's quite a bit of other reflexes. There's the stepping reflex, but of course the stepping reflex doesn't come until later on. Not for the newborn, because of course they're not stepping, but some months later on, the pediatrician would normally check to see if when they put their foot down on something, are they moving their feet in this stepping motion. Okay, so we talked about what mothers can do, but what about the father's role? Fathers can be crucial during prenatal development and a newborn's life. There's something called the Couvard syndrome. These are symptoms of pregnancy and birth experienced by fathers. Fathers can gain weight while wives gain weight during pregnancy. Some fathers have reported rashes and other issues when it is their wives become pregnant. No one knows why this happens. It could be because they're in the same home and maybe dad's a little stressed out as well. Who knows? But they're giving it a name, the Couvard syndrome, and it's very interesting, very interesting phenomenon. What is the father's role? To support, to be supportive, to be there, to be active in that child's life when that child comes into this world, and also to really, well, I already said support, not just financially but emotionally, be supportive for their wives and their child. So, closing thoughts. The most dramatic and extensive transformation of the entire lifespan occurs before birth. And this is where it is, you meet that right individual. You hopefully fall in love in that order. And what this is saying is it starts with genes. Making sure that two people come together and the genetic influence that you have on creating this new human being doesn't affect that child as they enter into this world. So it's important to, I guess, pick the right partner. So definitely want to think about prenatal development and birth. You won't have any exam or test on this, but it was important to note, and this is the end of my slide. I'll go ahead and record another one on middle and late adulthood.